If we scan it, it does not give us any information. It's possible that person carrying an ID card could commit a crime, and the person will just vanish and will have no information.
Like you are, let's
So I
move
think in giving those ID, I don't know who have those contracts,
then
but we need to make sure that those barcodes are
to conversation there at the Liberian Senate yesterday during the appearance of Minister Cooper Crowd, the Minister of Labor. So he is expected to return on June 3rd, as he requested from the Senate to be able to provide those categories of jobs that over 8,000 foreign nationals are doing in the country. So, like we've said, we have in our studio Dr. Chris Yan. Dr. Yan is the Director General at the National Public Health Institute. Even though we have a limited time, but I think we can get some information from him just before the show comes to an end here this morning. So, Dr. Yan, welcome to the program.
Thank you very much.
Okay, this should be your second time, you know, right?
Yes, my second time.
Okay,
Yeah.
So welcome, and how is the Enfield?
The Enfield is doing well amidst current, and ongoing challenges, which all of us are facing, and we're currently actively responding to the viral outbreaks, including the Empox, Lassa, and measles.
Okay, yeah. So quickly, you just want to give us the current status of Empox outbreak in Liberia?
Currently, as of the data that we received, we have 4 active cases in the country.
Okay.
We have 78 recoveries, and we have 0 deaths.
0 deaths.
Yes, that's the current status.
Okay.
And that may increase as we continue to test and we continue to do an active case session.
Okay.
And particularly given the uptick and upsurge in cases in neighboring countries, particularly Sierra Leone, we are watching that border very closely. We should be visiting the borders, one of the borders today.
Okay.
And we will visit the others subsequently.
And what's being done by the Enfield to contain these cases, to contain the spread of the Mpox virus?
What has been done is to continue to send out messages in order to have the population aware of the disease.
Okay.
And we continue to also do what we call active case search.
Okay.
We go into the communities and do active case search from the awareness. People who feel that they have those symptoms, which include fever and those rashes and those bumps with the pus in them that are all on the body and in the palm of the hands, they then report themselves to the nearest health facility or report themselves to the public health entity, Enfield. And what we also continue to do is to increase our surveillance and our monitoring system along the borders and at our ports of entries, NPA, RIA, and our viral border points, for which we're visiting some of the borders today, mainly the ones that are along the Sierra Leonean side.
Okay.
We also continue to increase our diagnostic capabilities, bringing in more reagents by help of the country's own resources, in addition to what partners are also donating to us. And we continue to do sequencing so that we know what is actually circulating, because we have that capacity in country now. We don't have to send samples out.
Okay.
We do that right here in country.
Okay. And how long does that take?
Well, it takes anywhere, if we have a suspected case, it takes anywhere between that very point that we extract the samples from, or the specimen for testing. It takes anywhere between 3 to 72 hours to get a result.
Okay.
So we get a result pretty much the same day. Depending on the time we take the specimen, we can get it within 12 hours, we can get it within 24 hours, but we give ourselves at least 3 days. We can get the results out.
Okay. You earlier on talked about the signs and the symptoms of monkeypox. I know one of the popular signs and symptoms that a lot of people know about monkeypox or Empox, as it's universally called now, is the rash, the skin rash.
Correct.
Yep. But you just want to drill us through other signs and symptoms of the virus for awareness purpose.
Yes. Mpox is the disease that is caused by the virus called monkeypox virus.
Okay.
The virus was first detected in monkeys around 1958. And we see that it comes from, it is also found in other animals in the bush.
Okay.
Like certain rodents, like rats, squirrels. We've detected that in those. Then it transmits to humans and then from human to human.
Okay.
So that's the mode of transmission. When you come in contact with the disease, you get fever, headache, backache, some of your lymph nodes, like, sometimes you get sore on your foot, then right here you can feel, right to your thigh, you can feel, something pinning there, those lymph nodes. So those lymph nodes can swell out. That shows your body is reacting to the infection. Then, of course, the classic symptom, which is those bumps, and they are very large, they're very big. They are different from smallpox bumps. So they're in the same family. Smallpox and Mpox are in the same family, but Mpox is a little different. So we are dealing with a different virus here. So those bumps that we see, those rashes and the bumps we see on the skin, the typical aspect of this Mpox is that they are larger, they're very big, and they are full of a lot of pores. And you can find it in the palm of the hands as well. Now, we have noticed also is that in certain other clinical jurisdictions, like in the East African countries, we noticed that those rashes can be genital, meaning they can be in the private parts areas, for which we're looking at sexual mode of transmission, physical contact. That's how you get it, through physical contact. So if anyone has this, you see them visibly, they have these rashes, and they sit on a chair or they lie down on a bed and you go sleep on the same bed. They might have left those viral particles there, and you pick them up, for which we then, as a measure, we ask the population, the citizens, to, if you see such things, you notice such things with your family member, with friends, you keep a distance and report that to the nearest health facility. Do not take bath with the same towel they took bath with. Don't sleep on the same bed that they slept in, because they may have left it there, and if you go to sleep on that bed, you could get it from that kind of contact. So those are that's the mode of transmission, how we catch it. Those are the symptoms that I have just counted, and that's how we take the samples, then take them in the lab, and when it turns out positive, then we isolate you, meaning we take you aside. You can be at home depending on the severity of your case, or we take you to an isolation point. We have isolation, which has been, isolation unit, which has been renovated recently. The Ministry of Health did a very excellent job in that at the base called, the area called Star Base. It was used for, I think, Ebola, COVID, and all. So those facilities are around, and that's why we are doing this tour again, in order to reactivate those facilities and bring them up to speed, so that when we have cases that require clinical, medical isolation, hospital type isolation, we'll have those units ready.
Okay, yeah. So how deadly is this virus we're talking about compared to other viruses we've dealt with here, like the COVID, like the Ebola, like you talk about having several cases but no death. How deadly is it?
Well, Ebola was a very deadly virus. We saw what COVID also did. What we try to emphasize is that no one should think that no virus is less deadly than the other.
Okay.
Every sickness can kill you depending on how you handle it.
Okay.
So we emphasize that we continue to take those measures that we just enumerated,
Okay.
that we just stated, keep close watch on those symptoms. If you see them on the person, on your family member, report them. All of these viruses are deadly. You can see that this virus is killing a lot of people in the eastern part of our continent, in Uganda, in DR Congo, in Burundi, many other places. Right next to Sierra Leone, you see how many people have died already. I think they reported up to 14 deaths.
14 deaths.
Yeah, and they started, our Sierra Leonean colleagues started their response somewhere around November, December, the exact month I can't get, but we started our response far before then. Yes. So the data we are presenting is from January 2024 to present 2025, May 2025. They started far late, and they started picking up cases in around November, December. They have a few cases. March, after March, they had some of their few cases. At the time, they had one death already, and now they have about almost 2,000 plus cases.
Wow.
With 14 deaths. There are some recoveries also, about 300 recoveries also over time. But currently, they have about 1,000 plus active cases. We have 4 active cases. We got some samples in recently. At the moment, I don't know where those specimens came from, the various areas.
Okay.
And as we said, the more we test, the more we find, the more we will get answers. And so we may have some more increase, because over the weekend, before the weekend, this gone weekend, we had only 1 active case. Okay. Over the weekend, we tested about 12 to 15 samples. 3 were positive. So we had 3 positive cases adding on to that 1, giving us 4 active cases. Okay. Just in the last 72 or so hours, we got most samples coming in, and we tested them. We hope to see what we get out of that. But we expect that with cross-border transmission, meaning cases coming from Sierra Leone into, we may see some pattern, and that is why we are concentrating on the border, and we will be going there. We have already strengthened and activated our surveillance officers there, the port health officers, district surveillance officers, county health officers, and zonal surveillance officers, and our diagnostic team that will take samples and send them over to the National Reference Lab for testing.
Okay, yes, and also you just want to talk a little bit about the treatment method, because a lot of people, when they experience these signs and symptoms, during this kind of time, they are afraid to report the cases or to report themselves after encounter or experiencing these signs and symptoms, because maybe they have fear about the treatment method.
Yes,
the isolation, the quarantine, and everything.
Yes, we are very cognizant of that. We are aware of people's fear, people's anxiety.
Okay.
And that is why during the course of our response, as you will note, we had almost about 500 or so suspected cases. Again, let's be careful with these words, suspected cases, out of which we tested, and we got these 70 some more positive cases that we treated until we had 0 cases at some point in time in December and in March.
Okay.
Now, we provide psychosocial counseling as well. We, at this point, in fact, as you can see, we try to send out our messages so as not to create panic in a society. As you saw, many people, we've been responding as you've been following, but many people did not know, they didn't have that fear, like people were all afraid during COVID time. So we've been very careful with our messaging in risk communication. What we have done also is to ensure that most of the messages go into the counties. We've done that in the vernacular, but we need to increase that intensity of our messaging. Okay. Quite recently, what has brought this to the fore now, as some people were denying it in the initial stages, in the population and even in higher places. The celebrity comedian, our Liberian celebrity comedian, who came out very openly and, publicizing his case. Now, remember, all of us watched those videos. He said, I have monkeypox. I have Empox, right?
Yeah.
Okay.
Sure.
How did he know that he has Empox? He did not test himself, but it's because of the messages that we have been sending out. So when he saw those symptoms, he immediately already kind of concluded what he had without being tested. And so he's among those people who have now carried out our messaging inadvertently. So it has increased the awareness. And so we really want to thank him for that bravery and for that patriotic move that he took. Because many people would have said, just as you're saying, well, I'm not going to show myself out there. Yeah, people will stigmatize me. Yeah. Now, it's treatable. Okay. He's, patients of that category are in good care. They're put at the star base, or depending on the severity, they are placed in what we call home-based isolation, meaning they are kept at home. They don't necessarily need to come to the hospital, but they are isolated in a particular room, and only the healthcare worker and the contact person from the family, one person goes there with the proper gears to treat them so that no other person gets infected. So it's treatable. We treat based on the symptoms, those symptoms that we talk about: headache, backache, fever, and then, of course, the rashes. There are medications we have to treat that. And we have what we call antiviral, because it's a virus. We have antiviral that we use to treat them. So when you have this, if you think you have this, don't begin to treat yourself at home. Report yourself, because some people may make the mistake of going to take some medications that they're not supposed to take. People may take antibiotics, for example, because there are different types of medicines. You think, okay, if I see terramycin, I can take it. If I see amoxicillin, I can take it. No, these pathogens, these diseases, they are different. And that's why we target them with different specific medications. So come to us, report yourself, and we will be treated. In Liberia, we currently have 0 deaths. We really are making efforts in our case management, which is mainly handled by the Ministry of Health side. And the isolation issue is handled both by the Ministry of Health and the National Public Health Institute, the home-based isolation. So you see, we have 0 deaths up to now. That shows the intensity at which we have been proactively handling it. There will be more cases, but we'll continue to treat them proactively and target in a targeted manner as best as possible, so that we don't have case fatalities.
Yeah. So there has been a lot of questions coming about the vaccination. I personally have received a lot of questions about the vaccination. People asking me, "Oh, can I go to take the vaccines?" I saw Teddy Rai, taking the vaccine. You yourself did take the vaccine, and other Liberians have been taking the vaccine. So you want to tell us about the vaccination process? Is it something that is open to the public, or is something for specific individuals?
We have a vaccine pillar, or let's just say committees on the incident management system of the Empox. That's the big committee, the IMS, which is the big committee that is responding, of which I'm chair from the National Public Health Institute. The Ministry of Health is the co-chair of that. On that big committee, the subcommittee called the vaccine pillar has been handling our vaccine actions very well, our vaccine promotion and procedures very well. We received some vaccines from the Africa CDC, the Africa Centers for Disease Control. I'd like to make that very clear so that people don't think I'm talking about Africa CD political party. So,
Sure.
So we got those vaccines. We launched the vaccines in Sinje, and about on that very day, the Minister of Health, Dr. Louis Mpoto, and I took the vaccines and to show the public that the vaccines are safe and they are effective from the test that was done with them on the scientific side that we studied. As you can see, I'm here, I'm alive. So you see the vaccines are safe. Dr. Poto is personally representing the country outside of here at the World Health annual meeting in Geneva, Switzerland, and she's healthy. She chaired a meeting just recently. One of the meetings that that nominated the new head of the WHO Afro. She chaired that session. So you can see how healthy we are, and we're responding to this. So the vaccines are safe. Don't be afraid. We are very happy that people are coming up. That shows the level of advocacy that we have done, the awareness that we have done. As you saw, I took it. Where are these vaccines? We got about 10,080 doses. And these vaccines are supposed to be given in 2 doses. So it means there's 5,040.
5,000.
Yeah. Now, we have a population of 5.2 million. So we are very strategic the way we administer the vaccines. What we are doing is, and thanks to our vaccines pillar and the DRDE, which is the Infectious Disease Department, the Epidemiology Division, that we put these plans together, these strategies together, and our partners, Africa CDC, US CDC, WHO, UNICEF, and the rest, AFINET, and all of you. What we have done is to target those that are immediate contacts of positive cases, because there's a risk that they could be infected, right? So when we detect that this person is positive, then who did that person come in contact with? We grab those ones first. Now I'm using the word grab, for sake of lack of a better word to use at the moment, or not, facing the microscope. Sometimes you don't know what to say. So we then gave those few persons the vaccines, right? Then healthcare workers, because we are the ones, public health responder healthcare workers. So we take the vaccine. So you see, the first group of healthcare workers that took the vaccine were the Minister of Health and myself. So healthcare workers are the next in line. Now we are kindly requesting Gavi, the organization that sent us those vaccines through the Africa CDC, to send us more vaccine. As they can see now, in our country, people want the vaccine. In other places, people run away from the vaccine. So we really thank the population. I mean, my heart is so gleeful this morning and every time when people come forth to say, where the vaccine? I got lots of text messages coming into me, lots of calls. We have a vaccine center at the Dupo Road Clinic. But again, the criteria that I just listed, I know people have gone there and they say, I went there and the people say, no, I can't get a vaccine. We are so sorry. It's because you are not a line listed of contact of people or who have been infected. Now, there's one good news. The Jamale Clinic, Jamale Clinic?
I hear the bit.
Right. Our dear active and very proactive executive director of NASCOP, Mr. DeWitt Vabamos, got in contact with me just recently, and we discussed, and he said, look, we want to make offer Jamale as one of the vaccination sites. So we said, oh, thank you. He said, and in fact, we're going to carry out a procedure whereby our healthcare workers there can be vaccinated based on the programs. And I'm putting out the secret here because we are on air. And thank you so much to NASCOP that have come up with this offer. And that is the kind of cooperation that we want in a society, working collaboratively with each other. We don't have to wait. See, he came forth with his entire entity. So we are going, and don't start running to Jamale now. We're still organizing it. We are just telling you so that at least you can have it on mind that we're going to have another site, a clinical site, where we will deposit vaccines for specific persons to take. The day we have more vaccines, we will put it out for mass vaccination.
Okay, Dr. Yan, unfortunately, we don't have the luxury of time. It's already 10 o'clock.
Yeah.
wish you had come sooner because we had a lot of questions to ask, but maybe we can invite you another time.
Certainly.
Yes.
Certainly. We can do that.
To have more conversation.
We will.
Yeah, sure.
We are in a response mode presently, and there are quite a lot going on. This morning, we will be having an emergency incident management system meeting. So IMS meeting this morning at about 10:30. So we should, I thought, in fact, if you have more time, we will use that time until by 10:15. I would like just gone, since we are not far from here, but you have your own radio time.
We have your radio time into another time. So finally, what can you say to the public?
Well, we ask the public to be very calm. Do not panic. Do not panic. We're doing the best we can with the trained forces that we have, these trained responders, these epi-surveillance responders, our diagnostic technicians and technologists and scientists. And with the technologies that we have now, with the sequencing technology to know what we have circulating, as we already know, we have type Empox type 2A and B circulating here, whereby type 1A and B is circulating in East Africa. So we know what we got here. So with this kind of information, we are able to respond appropriately. So don't be afraid. Back in the days, we didn't know what we had. We only knew COVID was circulating. We don't know what type was circulating. We only knew Ebola. We didn't know what type. We had to send samples out. Now we do that right in country. So thanks to the government of President Joseph Newman Boakai that is very keen on healthcare and public health, that we are able to combine with our partners' assistance to have these things done in the country, which has elevated our public health and healthcare response in the region, for which Enfield now is designated as a center of excellence, and we are going to be training others. What we've done also is to reach out to our Sierra Leonean brothers and sisters. We talked to the NFA there, which is the National Public Health Agency. We are offering diagnostic services to them. Since we are not fighting and just bring the stuff over to the border. If they want sequencing, genomic sequencing, they just bring it over. We can do that right here and get it back to them, so that we have within that 72 hours, 7-day window in detecting, finding the case, detecting, reporting the case, and then beginning to treat the case. That platform program that we call 717. So that way, both of us will be within there. We are also actively engaged in Guinea. But for our people, please be calm. Do not panic. We are having it under control. There will be cases coming up, but don't panic.
Okay, so you just want to address the concern of one of our viewers, Krubo Onambajo Matthews is asking, are infected individuals eligible for the vaccination? Infected? Whether infected individuals are eligible for the vaccination.
Well, what we do, you see, during the course of infection, what we know scientifically and medically, you begin to produce response to the very infection. Okay. So at that rate, in all infections, we don't immediately vaccinate you. Okay. We wait for your own body system to kick in. And that is where the sickness come about, because when your body response kicks in, it begins to build almost the same kind of things that we would have injected in you to trigger your body to do that. Okay. So we wait for that. What we do, we concentrate on is to treat you so that you get well. Once you get well, we test to see how much of your response is capable of beating back the virus when it comes again before we give you vaccination. Now, there has been this thing of people seeing the picture and saying that, why is it that people giving you the vaccination with their bare hands?
Okay.
Vaccinations of this type, which are intradermal, subcutaneous, they can be given with sanitized hands without gloves. It's acceptable. But again, it is very good that healthcare workers put on gloves before giving vaccines. So we just want this argument not to distract us from responding. Go and take your vaccine. I'm glad that has brought up the question of people taking vaccine, because if they didn't even see that, they wouldn't be talking about vaccine again.
Yeah, sure.
So these little things help us also. Thank you to our our celebrity comedian. Thank you to Teddy Rai.
Yeah.
I hear his voice on air sometimes with this advertisement. I haven't seen him.
Okay.
Thank you to Teddy Rai. Thank you to there is another young man who met me recently, Kobasi.
Kobasi, okay.
Yes, Kobasi. And we have our own Sosome.
Okay.
You know Sosome?
Sosome?
Yes.
No.
Oh, that's an internet sensation.
Okay.
And she's putting out some videos to do some awareness. So we have our celebrities coming to help out with this themselves. They're just volunteering themselves, and we are very glad about that. We thank them very much, and thank everybody. I mean, all of us are celebrity in this whole thing here. Thank you too to the press. You've done excellent.
Okay, thank you very much, Dr. Yan. It's been a pleasure having you. Look forward to having you another time as you respond to this virus.
Let's do that. When we come from the borders today, we'll be available during the course of time, and we can arrange it.
Okay, thank you very much.
Thank you, I appreciate it.
Okay, so folks, that's it. He's the Director General of the National Public Health Institute of Liberia, Dr. Chris Yan. There, he's been our guest on the show here this morning. Sorry, we didn't have the luxury of time, but like I said, we're going to arrange another a LinkedIn interview where he's going to address a lot of issues. Thank you. Join us another time on this station when we be back here. My name is Yekezi Zobe, bidding you a pleasant goodbye from Odious Congo Town in Monrovia, Liberia. Bye-bye.